So you've injured your knee, but guess what? You've come to the right place. This video will point you in the right direction.
Here's how it works. In this video, we're going to go over common types of knee injuries, the situations in which they occur, and the most common symptoms associated with each. If what you see describes what you're feeling, follow the links and explore the videos. We'll help you get the answers you need. Here are the topics we're going to cover in this video. If you already know what you're looking for, use these links to get you there. Before we move on, let's discuss what we would consider emergency symptoms. If you are experiencing any of the following, it's probably a good idea to stop watching this video and contact your doctor immediately, or head to your closest emergency room. If you're still watching, let's start by asking yourself these simple questions. Did I sustain a direct blow or impact to my knee? Was I involved in a biking, skiing, or other accident? Did people gasp when I went down? If you've answered yes to any of these questions, click here to learn more about impact or traumatic knee injuries. Still here? Great. Now let's move on to the non-contact knee injuries. Did you twist your knee and feel a popping sensation? Does your knee feel unstable or that it's giving out when you move? These symptoms may be signs of a ligamentous knee injury, the most common of which is a tear of the anterior cruciate ligament, or ACL. However, there are several other ligaments in the knee that when injured can present feelings of instability. Click these links to explore our video series on injuries to the ACL and the other ligaments of the knee. Speaking of clicking, if you're feeling a click, catch, or that your knee locks up, you may have suffered an injury to either the medial or lateral meniscus, or the cartilage that lines the bones of your knee joint. In both cases, your knee may become acutely swollen, or it may be painful when you bend deeply, squat, or use the stairs. For more information on meniscus tears and articular cartilage injuries, check out these links and we'll help sort things out. Another type of knee injury that can occur involves a subluxation or dislocation of the patella, or kneecap. This can happen for a variety of reasons and can also happen more than once. You may have even had to pop your kneecap back into place by yourself to get your knee to move comfortably. If this sounds familiar, click here to check out our series on patellofemoral instability. Not all knee pain comes from one specific moment of injury. In many cases, people will experience discomfort in their knee when performing their everyday routines. This may feel like a deep ache in the front of your knee. These symptoms often relate to cartilage wear and tear in the area behind your kneecap, or where it glides along the femur. It's a syndrome we call chondromalacia patella. Click here for more information on this topic. Another common type of knee discomfort involves tendinitis, or inflammation of one of the soft tissue structures that connects muscle to bone. These symptoms are not usually associated with a specific moment of injury and can be present during all types of common activities, especially anything involving a deep knee bend. You may also have point tenderness around the edges of a bone. If this is the case, check out these videos on common types of tendinitis of the knee, and you'll find plenty of information to help you figure out what to do next. We know that there are many different ways that you may have injured your knee, and you may not be sure which path to follow. It's possible that you are experiencing a combination of the symptoms we've mentioned before. If so, feel free to browse around. You'll find lots of helpful information on everything we've talked about. Here are those links again.
If you have any further questions, please leave those in the comments section below and keep coming back to ReadySetMed for all your medical needs.